Well, I'm delighted to be with the first of our exhibitors here, and this is ACIC Pharmaceutical Machinery. And Eduardo, fantastic to meet you this morning. How's it going so far?
Well, it's a very exciting time for us to be here in Barcelona. We attend every single CPhI show, and now we are attending PMEC as well.
Okay, good. And you have brought a cornucopia of very exciting looking machinery. So could you tell us a little bit about what your company does, its place in the pharmaceutical marketplace?
Sure, yes. ACIC, we are in the business for over 43 years, and we represent pharmaceutical machinery manufacturers as well as chemical manufacturers. So here we're going to talk about machinery, pharmaceutical machinery only. In this case here, this machine, for example, is built by GF in Italy. And this is for a cartridge filling system, fully automatic. There is no contact with operators, only working with robots. So we ensure the precision of the filling and the quality of the closing. So this is state of the art in terms of technology available to our clients.
Okay, and in terms of your clients, is this bespoke for everything that is made? So for example, I see that you're filling these little vials here. They're bespoke, are they, for each client?
Yeah, we can fill not only cartridges. In this case here is a cartridge, but we can also fill vials or ampoules, IV bags, or even large bottles. But in this case here, the client required us to design a high-speed machine with very precise machines, so we came up with this solution.
Well, I mean, what sort of capacity does it have? How quickly can it produce stuff?
This can go up to 10,000 units per hour.
10,000 an hour. That's a lot of units.
Yeah, it's for high capacity. I mean, large laboratories are the ones who are willing to get our help for this sort of machine.
And how does this compare in the marketplace with other manufacturers? Because clearly this is a very competitive field.
It is. Well, we have, let's say, the flexibility. Our engineers here are very flexible, very innovative when it comes to different solutions that we have to bring to the market. So that's what differentiates us, the innovative mindset of our engineers.
And what would be the lifespan of a machine like this? 5 years, less than 5 years?
I would say at least 5 years, 5 to 10 years. But of course, there's always upgrades to be done, so we are always in contact with our clients to provide them with the latest upgrade we can on those machines.
And you said you represent these companies, and this is particularly in North America, is it?
Yeah, and Canada and US. We represent 8 Italian companies and 2 other Canadian companies. So in total, we have 10 partners in North America.
I imagine that's an incredibly competitive market, trying to do business in the United States and in Canada. You know, they have great technology there as well, and you're selling European goods.
Yeah, it is. But in North America, our clients, they know the quality of the European machinery, so they're always like having an eye on the solutions that we provide them with.
Yes, you have to keep telling them the European finesse there. So tell me, could you just talk us through how this machine works from beginning to end?
Here. So starting this point here. So here we got the cartridges. They are loaded actually upside down and empty, of course. They are already pre-sterilized. So it goes through this system here that will automatically bring it to the closing station. So it's even empty, but we are already closing it. At this point, you can see the crimping station. It is transferred to this other station, which will put upside down. So now we have the lid down, and then we take it to the filling and vacuum. So at the same time that we are filling this cartridge up, we have vacuum applied, and we also insert the rubber so that perfect seal, no air in between the bottom of the stopper and the top of the liquid. And coming here, of course, we have some inspection, because if there is any problem with, let's say, the crimping or the sealing, the cartridge will be automatically rejected at these two trays. And as you can see, most of them approve it, go to the other side of the machine.
Wow. And in terms of quality control, how good is this machine?
We use several, not only this machine, but typically we have vision control and X-ray control. So depending on what you are willing to control. If it's just cosmetics, typically we use cameras. But if you want to go deeper and see if there's any particle inside, then we have to apply some more high-end technologies to be sure that there is no particle inside as well.
Okay, so if I decide that I'm going to buy one of these machines, what sort of downtime do I expect? Can this run continuously 24/7?
Those machines are designed to work 24/7, 3 shifts. They, as the capacity I told you is very high, our clients don't want this machine to stop for a minute.
It's what, sorry?
They don't want the machine to stop for even a minute.
Well, no, if I'm buying this, I certainly don't want it to stop for a minute. No. Okay, so if you take us round and show us what else you've got on your stand.
Well, this was GF. Another partner that we have is Sterilisation, and their expertise is sterilization. So, for example, if I have to sterilize parts like the vial itself or the capping, I have this sort of equipment, which is a sterilizer and autoclave at the same time. So here I have the input where I'm going to load all the parts inside.
Right.
And at the other end, I get the parts sterilized.
So I'm very familiar with an autoclave being a very hot oven which heats up and destroys bacteria and so on. So how does this differ from any other type of machine like this?
Precision, and you're 100% sure that once you get this part at the other end, it's 100% sterilized as per the requirements of our clients. So this is the quality that we bring with Sterilisation.
What sort of temperatures are you heating this to?
It depends on the product. It depends on the material that you are handling. Of course, the plastic has not the same capabilities of a glass, so it's a lower temperature than a glass.
Okay, and then over here?
Sure. Let's suppose that machine has to stop because they want to change the size of the vial or I don't know what. So all the toolings will have to be disassembled and sent to this station here. So this station here will wash and sterilize again the tools that were used on that machine. Or sometimes in your laboratory, if you have some, let's say, vials or some other materials, you just put here, and this is actually just like your dishwasher.
Do you know, I was going to say, it looks like a glorified dishwasher.
It's a huge dishwasher.
Right. Okay,
and this gives a good clean and sterilization of parts and tools.
And what sort of temperatures does this get to?
Again, it depends on what you're willing to sterilize. Can go up to 124 centigrades or even higher. Again, every single project is customized according to our client's requirement.
And of course, this whole business of making sure that everything is sterile is so important to clinicians like myself because we've got to stamp out the rise of these super infections.
That's correct. And most of our clients are into the injectable market, so we've got to be sure that everything is perfectly sterilized. Not only the product, but also the machine and the tools.
So in terms of representing all of these companies to North America, to Canada and so on, what is your elevator pitch? What do your clients know you for? Is it the fact that you deliver quality machinery, or is it the safety, the efficacy? What would you say is your main kind of measure of success?
I would say experience, because together, I think if you have everybody together, every single partner that we bring to this business, they bring at least 35 years of experience in that particular technology that they have, particular field that they have. And ACIC, we are also pharmaceutical machinery, so we know exactly what our clients are expecting from us. So this is what differentiates us, so experience in the pharmaceutical industry.
Okay, and in terms of your clients over the last few years, what's your retention like? How many stay with you?
Well, most of our business are repetitive business, which means our clients are buying from us, they come back buying more and more. And we attend not only big companies, but also small laboratories across North America and in Europe too. Yeah.
Super. Well, thank you very much, Eduardo Andrade. It's been a pleasure to talk to you. Thank you.
Thank you.